Hey, welcome to Dental Voice with Zyrus. My name is Rolando Mia, and check it out. We have Dr. Marc Liechtung for the fourth and final episode of this series that he's been taking us through about thriving in a dental practice. Today, he's going to cover one of the most important things. What is it? What are the top three biggest mistakes that owner dentists make when they're trying to grow profitable businesses? In his first episode, he talked about finances and why that's important. In the second episode, then he talked about how dental hygiene is the tip of the spear and why overlooking that can cause you to fail. In the third episode, he talked about procedures that clinicians can perform, dentists can perform, that they're referring out and losing literally hundreds of thousands, if not millions of dollars over the span of the practice. He's bringing them all together. First of all, Dr. Liechtung, thank you so
Thank
much
you.
for joining us. I learn so much every time you're here. You are
Thank you.
absolutely amazing. You're awesome.
Thank you, buddy. You're awesome too.
All
It's
right,
great
so let's
seeing
hit
you,
it.
Ro. I know we've been traveling a little bit, both of us, so it's good to be where we belong, helping
There you
people
go.
get better. So let's do it.
So hit it here. If you were to summarize based on your experience, based on what you've seen, and most importantly, lessons learned, what are the top three, number one biggest mistake that dentists make, owner dentists make when they're trying to build their practice? What would you say is number one?
The number one, I believe strongly, the number one aspect is know your numbers, or you'll never be as successful as you think you will be and could be. Know
Know your
those
numbers.
numbers. Know the numbers of the practice.
So what do you mean
Understand
know
them.
your numbers? I mean, I know my numbers. My production is X. What do you mean know your
Exactly.
numbers?
Well, let's take some of the things we've been talking about over the last three sessions. Raises, operationally buying more technology. Can my practice afford it? Can I give my hygienist another $3, $4 a raise an hour? Or do I have to look for someone else or put her on a bonus plan? Know the numbers of the practice so you can afford to do the things you need to do to thrive. Or tell them honestly, be transparent and say, hey, knowing the numbers, let me show you. I'd like to give it another few months and we'll revisit it. But by giving things blind, you could end up with a heap of hurt in your practice if you don't take control of it.
Now, of the numbers that you need to know, what are the top ones that you would recommend that every owner dentist knows? What would you say those are? Top five metrics.
Yeah.
Obviously, there are more, but what are those top fives?
Clearly, the operations that get away from a practice is number one, dental supplies. Dental supplies, is that what you're alluding to, Rob? The
Yeah,
five
yeah. What are
things
the of any
dental,
dentist watching this right now?
right?
What are the top five things? I want you want them to go back and go, wait, I don't know this. I need to know. So dental supplies, number one.
Number one
And
is dental supplies, understanding what you're buying. Are you better off buying it in once a month or twice a month? Are you paying for extra shipping or are you getting shipping free? Also, source it. Find the best possible options you have for those materials. Number two, lab. If you increase your revenue, go to your lab. He's your partner. She's your partner. Work with your lab and say, hey, those fees are a little high, but that's the number two thing. Three, staff. We alluded to it with the numbers. Know the numbers. Know how your team can afford. You can afford your team and they can afford you. Give them bonus plans. Give them bonus projects. Let them exceed when the practice is successful. For marketing. A lot of us just want those new patients. We run out and we throw them $100,000 out of marketing. What's the return on investment? We hear about those three letters ROI, but what do they really mean? Am I getting a one-time, two-time, four-time? Is it just an explosion of new patients? That could be something we target in the new year of 2023 that you put more in. And the fifth is obviously the space. You can't, for young dentists and dentists that I've spoken to yesterday that are looking for a new space, you've got to maintain what you can afford. You can't look at a space that's double your rent, but you don't need double the cost. You can't afford double the rent. So make sure ego and practicality. Ego has to be checked at the door, and using the numbers and the science of the practice to determine every aspect of the practice. It's not a guessing game.
I love that. So Top five. Now, are those in order? So it sounds like people will get all twisted about supplies when it's a small percentage of the business. When headcount or staff costs are
Yeah.
huge. What's the order of magnitude and
You know,
importance of those?
my finding and what I find when I go around practice is the overload of teammates or overload of staff. You're not going to go to two hygienists until your doctors seem to be in line of what they need. It's
Ah,
not a it's not a Costco where I see 100 people walking around a practice, in a building. It really, doctors have that pretty much with give or take maybe a half of a salary. It's the supplies that could, because I consider those are the things we're not watching. Supplies, I don't. If you have a busy practice, you're not ordering supplies, so you're leaving it to someone. Once a week, have a meeting, or twice a month, have a meeting and see what's the percentage of the supplies of the practice. Why is it higher than 8, 9, 10%? Why is it getting out of control at 20%? Are they just ordering from anybody, or are we getting discounts that are out there? And maybe who's ever doing the ordering could take a little time. There's a science to it. Source it, find the best pricing, or deal with the one. Listen, we have major reps and major companies that will give deals. Use them and keep your eye on them, because the natural progression of a supplier is to elevate those numbers. We're not watching.
I love that. When
Yeah,
you're not watching, they go out of control.
yeah, yeah,
Headcount, cost, and then where does production fit into this? And
yeah.
then the types of procedures you're looking when it comes to the finances. Where would you kind of put those?
Correct. We talked about it. The procedures are what drives the revenue. It's a see and a saw, right? The
I
revenue
like
goes
that.
up, and the expenses, if we could keep them down, we have a very successful practice. I'm not talking about keeping them down in regard to the same number that we're producing, but I want doctors to understand that if a practice produces $500,000 and your supplies are at, let's say, 10% for easy math. We don't want anyone to do math, right? So 10%. So no, seriously, make it easy. 50 grand, right? So it's a 500,000. Supplies are at 50 grand at 10%. If we go to 100,000, economy of scale, we could drive that to 7%, 8%, and by doing
Got it.
that, you're literally saving $20,000 to $30,000, which is pure in the doctor's pocket, by just taking the time and finding the best supplier for what you need.
Love
So
it.
it
Love it.
is, it's a percentage is what I'm trying to get at. Go ahead.
So it's finances. Number
Right.
two, what would you say the second biggest mistake that people are making that they shouldn't in building a practice?
If we're building a practice, the first thing I look for doctors to do, other than themselves in the mirror, which we will get to, is understand the importance of building a strong hygiene practice. Understand that it may not be per chair, more per hour in a hygiene's hands than it is in a doctor's hands, but over the long run of a practice, as we grow that practice, the hygiene department will feed the doctor all the time, and that
What
is the key.
When you say understand a strong hygiene function, what does that mean in
Yeah.
real, we're talking hard terms, concrete
I
terms.
met a doctor this weekend. Fabulous practice out in Carolina. One of the Carolinas. Don't want to be too specific, but he's alone with a powerhouse of a hygiene program. Powerhouse. He does multi-millions of dollars in his practice. I believe it's a $4 million practice with hygienists going all the time and a doctor that's fed and is looking to grow. And
Wait,
that's that.
he's booking 4 million in hygiene?
Booking 4 million in his practice
Ah.
with 4 hygienists going full time. And my point of that is what we talked about is that's a strong hygiene program. It's easy for him to grow his practice with other doctors. When that doctor's ready to have a succession plan, to bring in an associate, look what the hygiene needs to do. Nothing. Just keep going and just hand that new doctor the exams. You have so many opportunities with hygiene that could grow, promote a new doctor, promote new patients, and then promote treatment, as we touched on in our previous sessions.
I love it. So hygiene, and when you say hygiene, a strong hygiene is not just production. if I understand correctly, it's the engagement. It's how far out should hygiene be booked out? How many procedures, or
Yeah.
what is there? What would you say are the key metrics from a hygiene perspective that a practice an owner dentist should kind of
Yeah,
strive for?
that is a whole new series. But really, what you have to look for is in a practice, if you can't get new patients in,
Right.
if you don't set aside, and that setting aside time has not been able to be accomplished because you just overrun with patients. If you can't get a new patient in within 2 weeks, even sooner, I would open up a hygiene day. Now, if you're booked out 2 months, you need another hygiene day. And if you can't get another hygiene day, you may need to open up another day. And if the doctor doesn't want to open up another day, that's when the doctor brings in an associate to have the ability to open up more days, which is the next step as a practice grows. When to open up the practice, when to bring on doctors to do things that the other doctor is not doing, and utilizing hygiene to promote the new doctor.
Oh, I love, when you
Yeah,
think about it, that's so, because a lot of owner dentists are taking on all the responsibility of
correct.
driving that practice on their shoulders. What advice would you give people
Yeah.
to trust that, or to find those resources that they can depend on? How do you get past that? Well, it's all about me. I got to do it.
That's really in as we segue into the third aspect of what the mistake is not to make, if I can.
Yeah, yeah, please.
Okay, and that is that having doctors in my office that do not allow us or negate the reason to refer out so much. And I think the best way for a doctor to establish a plan of succession or a plan with an associate and build on multi hands in the practice, so the doctor isn't taking on so much, so the doctor doesn't refer out so much because he's either busy or doesn't do that procedure, is if I'm a doctor who sends out all my root canal, I'm going to find an associate that's really, really likes root canal. I'm going to make sure they take great courses. I'm going to make sure they're excellent in rotary system. I'm going to bring my vendor in and get that person trained. And then all the root canals in the office are going to go to that associate. And after root canals, as we know, doctors come post and core and then a crown. And if I'm busy in my room as an owner and that doctor will come to me, I see the root canal, we talk about it, I have confidence, go ahead, doctor, do the post-core and crown. That's how you establish that system through root canals, extractions, clear aligners. A lot of doctors out there are not doing Invisalign or clear aligners. One way to do it is bring a doctor in that is adept at clear aligners. Invisalign took the training, has done many cases, and it's exciting to add that into our practice. And all I'm doing is, from the hygiene department, we see crowding, we give it to the doctor. 6 months, 4 months, you'll see a whole avenue of revenue and treatment. You're going to get the scanners, the iTeros, and you're going to be either an Invisalign or a clear aligner office that has now migrated that into common procedures. So the way not to get stuck is don't refer out those millions of dollars of treatment that you could keep in your office.
And it sounds like, too, don't refer out, but you don't have to do everything if you can find an associate or someone you can bring into your practice. So the context, if I hear correctly, Dr. Marcus, keep it in your practice. That
As
way you're
much as
not
possible.
losing the
Yeah.
opportunity.
I hear all the time from older doctors. So some doctors that have established themselves in the community and say, I can't do that. I send all my cases to Joe. All your root canals you send to Joe. What does Joe send you? Once in a while, you get a case back. You're going to send your
Or not.
endodontist. You're going to send your endodontist tortuous roots, block canals, retreats, but you're just not going to send them number 8 or 9, the premolars or a straightforward molar, until you're comfortable and competent with that associate. But there'll still be room for referrals to your friends. Just right now, we are building a business, and the
Yeah.
business needs to stay indoors and
I love
kept on
that.
our premises.
The
Yeah.
business needs to stay. So your function at Guardian Dental is you look at and you evaluate practices. Share with us the top 3 or 5 absolute deal killers. When you walk into a practice, Number one, if you walk in and you see this, you're like, nope, not worth anything, or not worth what you think. Number two, what would those three or even five be?
I mean,
What would you say the killers?
for us at Guardian, I wouldn't go in if somebody is taking lower insurance or state insurance. The quality of dentistry cannot be to the same level as what we expect. You know, at Guardian, I represent along with our executive team, we represent unbelievable partners, quality doctors. And the number one aspect before I walk in is I look at, you know, the type of insurance. Is it fee for service, or are they, if they're playing in the low, it just might not be for us. We don't know how to work with the Medicaid and the lower fee, DMOs. But what I look for in the practice itself is systems, is quality, is seeing if the practice has a system of revenue. And when they bring in new patients, how many are bringing in? What are their reviews? Everything counts.
So a deal killer is if you go into a practice and they don't know how many patients are coming, they're not bringing in new patients, and there isn't an understanding of where those are coming. Is that, would you say that's number one?
I'm saying, to be quite transparent to our listeners, revenue and what they do on that quality basis is what we first get attracted to.
So that's important.
Next, yes. Is the doctor producing too much? Are the salaries too high?
Got it.
Right? Because you can't direct people to take reduction of salaries after you buy it. You will lose your team. So this is all, like we discussed previously, in regards to the EBITDA. We look at that word because that's operational profit, staff, all the things I mentioned. You see, at a company and a group like Guardian, where we have great relationships with top companies, we know that buying will be cheaper. But what we can't substitute is quality. We can't substitute staff salaries. We can't substitute rent is too high. And which doctor is producing what? And we touched on that last time, where I believe doctors, owners should try to assess their practices and get their own production in the 25 to 35%, no more, of that particular practice. If they're looking to be prepared for one of these groups to look at them and say, wow, you have a great practice. So another mistake that's caddied on using associates and using doctors that can do this is owners believing and demanding that they need to do all the work. That will be a problem when they go to figure out that magic EBITDA. So when I look at an office, it's not just one aspect. You know, if I walk into a neighborhood at this point, it's a complete picture. It's a mosaic of really amazing things that gets somebody, a doctor, a group, that magic great number, because they've watched all the aspects that we're discussing today.
I love that. Could you share some examples of no names, obviously no names, but one or two examples of practices that are implementing what you're suggesting and what the effect is, and then the ones who don't, and what the outcome, what that would look like? Do you have an example?
Yeah, well, we've been there are tons of examples as we are so busy looking at great practices around the country. But let's just go back to our example that we talked about, and let's plug in the things I've said not to do and those that do it. So we had that $3.6 million practice. One practice has their doctor doing $3 million of production. He's killing himself. $3 million practice, that doctor's doing it all. The EBIT, right? They're not watching. They're too busy, because what happens is, like anything else, complacency. And you can't blame a doc. He's making a ton of money, or she's making a ton of money by producing that. So my point is that if you look at these two practices, the one question is, what are the ownerships? How old is the owner to the one that is producing a whole boat of the practice, and the other owner who has seen the light, wants to sell, brought in associates over the years, is now doing about 28% of the practice. His supplies are about 6%. Lab is 7%, but going digital and going down. Rent, they own the space. It's a nominal rent. And all in all, that practice is thriving. This practice, although the owner is making a killing, might not be ready to sell because their EBITDA is so low because of the huge expense they don't watch is supplies, huge expense they don't watch, which is marketing, lab. You just cut, take an impression, and you're happy you're making all that revenue. Getting to market takes time.
Well, also that other practice where out of the 3.6, the dentist or the owner dentist is generating 3 million of it. When that comes in and they move out, all of a sudden, where's all that production, right?
Exactly. And that's why groups, smart groups, are getting very concerned about doctors. And this is new stuff.
Right.
Groups are getting very concerned about that follow-up, that next generation in that practice. Hey doc, you're phenomenal, but what's your next act? You know, we are only have so many years with our hands, so many years with our back. And what we need to do is understand that we could push away from the chair, but it won't cost us loss of revenue. That is the one leap of faith doctors have to take. They have to go to that cliff, to the edge, and say, bringing in a doctor the way I described it, letting that doctor slowly do the procedures you were throwing out, sending out, not doing. Keep it in-house and watch that revenue grow. And then when you're comfortable with that clinician, with that doctor, you will be taking time off, your revenue will grow, and your EBITDA will grow.
Well, and also
That's the exceptional part.
Well, you also maintain the quality of care that you're providing for your patients. You maintain the consistency in what it is so that you're not telling a patient, I can't treat you today, you got to head out. So your patients are happy, your team is
Yes.
happy.
You touch on such a major point that we are not touching on. And I do want to say this. I know we're coming to the end of our series and it's been unbelievable, but I love the dental profession. I really do. It's been amazing for me, and I meet so many phenomenal dentists. But what you just touched on is the point of stress.
Ooh.
Doctors, we go through a lot of stress. We have patients complaining. We're getting spit on. They're complaining sensitivity. As a business, we are so blessed. Take the time to look at growing your practice the right way. Once you grow your practice the right way, you're bringing in hands to help you. You don't have to go 8 hours a day, 5-6 days a week to make that number. You could do it smart. I don't sell anything. I'm telling you, from now till your end of your career, seriously, be cognizant of your own body, your mind. This is a marathon, not a sprint. And I mean this. You need to look at this for another reason. You're looking at every patient, and eventually it's no longer going to become fun.
Wow.
Truth.
Yeah, you just brought it all back together. You do this because you love it. Don't forget that you entered into this profession because it's something you had a passion about, and don't let it beat you down and make you dislike it. That is a massive message.
We at
People.
Guardian have a phrase, and I think it's really important, and it's learn from the best and share it with the rest. And we have such avenues to learn from people, to observe people, to learn from your partners or your friends that have grown practices. Learn what they did to bring in an associate. Take a course. Learn how to do that extraction and bone graft. So much to learn. Remember, I made the analogy of the golf club. Well, we talked about the golf bag. We talked about this for 4 sessions. I think we've added a lot of golf clubs in our armamentarium in dentistry. But
I love
I
it.
do reiterate, it's a great path. Remember, new patients, keep the cost down, produce quality dentistry at the procedures that you want to do, watch your team, make sure everything is in line with certain numbers. And these discussions are such an avenue of wonderfulness, because really it's such a learning experience. It's wonderful. We could talk about this. You have people that have experienced every aspect of a practice. It's a pleasure when you walk into a practice and you can see how well it's run. And if it holds true and it really is a great number, it's wonderful. It's those practices that are not aware. They're not aware of where they're at. And this system, this process, take a look at where you're at, understand it with your financial people, and then there are ways to get it better. And that's really what it's about.
That is
You
so
know?
awesome. Well, first of all, there are so many other aspects of this that we could dig into. Not now, however,
Yeah.
it's really appreciate sharing real life. What exactly what you're doing. If people wanted to reach out to you again, what's the best way for them to do that?
Email me at mliechtung@gmail.com. Love to take your questions. It's been really nice. But really, we're here to enlighten and educate to the best of our ability, and to really use this forum as an educational platform, or just to think, hey, I could do that. I could build this. I could work with my manager and look at the supply bill every other Thursday. But find the time. This is our companies. These are our companies. I was going to make one last analogy, and that is when a huge behemoth of a corporate company goes to market, they don't go to market on Tuesday after they decided on Monday. There's a process. For those of
Right.
you that are looking, what's the world like in the group market? That is where you should be looking. You look at inside, internally, see if my practice is reaching those goals. What am I producing? What's my hygiene producing? Get to know your own numbers. Get to know your own business, and you'll thrive. And that's the best way to do it.
Get to know your own business and you'll thrive. I
Absolutely.
love it. Dr. Marc Liechtung. Oh, thank you so much for taking the time. I know that you're incredibly busy. I know you're all over the place, but you've taken the time to sit there, share real stuff with us. Looking forward to it. You know what? Dr. Marc Liechtung has a lot more. If you have questions for him, please reach out. He can tell you. And here's what's awesome. No bones about it. He's going to be very direct about what it is that you are doing, need to do, and can help. The other thing is this: if you like this, share it, kick it out, share it with your friends. If you have questions for us, let us know. Dr. Mark, would you be willing to join us? Maybe we'll do another series, focus on other things. Is that something you'd be open to doing?
Rolando, I always said it. I'm an easy when it comes to you. You're a dear friend, and you've been a good friend. And quite honestly, this has been a joy. And I've been getting great feedback from people and saying it's been very helpful. And
Yeah, likewise.
it's a short little brief snapshot of our industry. And one thing I'll tell everyone: what a great industry, and how blessed we ought to be in it. I know
Yeah.
I am, and I know you feel the same way. So it's phenomenal. Thank you
Thank
for
you. And with
you.
that,
Thank you
hey,
for your team. It's amazing. You guys are the best. Thank you, bro. I really
hey,
appreciate it.
everybody, if you like this, please share, reach out to Dr. Liechtung. Thank you so much. Really appreciate that. Looking forward to spending more time with you. And check it out. Everybody, check out Dr. Liechtung. Check out the other 4 episodes and check back for more.
And I'm going to throw. Okay, thank
Go,
you.
no, no, go ahead, go ahead. Throw it, go,
No. I
do
know
it,
we
do
have a
it.
minute. I
No,
wanted you to
no, you
say
got to do
something.
it. You got to do it now.
Got to do it now. If you're looking for a group as a partnership, look up Guardian. They'll teach you a lot. Take care,
There you
everybody.
go.
Guardian Dentistry Partners. I have to say it. I love it. Take care, everybody. Be well.
All right. Take
Thank
care,
you.
guys. Thank you.